정부는 지금 상황의 엄중함을 직시하고
Facing up to the seriousness of the current situation, I appeal for the last time. If you, trainee doctors, return to work by Thursday, you won't be held accountable. I urge you to remember your voices will be heard louder when you are next to patients.
더욱 크고
This was the South Korean government's Minister of Interior and Safety giving a final warning to striking doctors to call off their protest, which has brought the country's healthcare system to a standstill. The medical professionals have been given 4 days' time to report back to work or else face indictment and suspension of their medical licenses. About 9,000 medical interns and residents have stayed off the job since early last week and so far seem undeterred by the government's warnings.
The Korean Medical Association Emergency Committee urges the government to start the discussion from the beginning. We won't be deterred by the government's warning of legal actions in our fight to establish right medical policies for the South Korean people.
The agitating doctors are protesting a government plan to increase medical school admissions by about 65% from 3,058 medical students in 2024 to just over 5,000 in 2025. The authorities raised the health alert level to serious on February 22, given the disruption to hospital activity caused by an unpopular strike launched by doctors. The walkouts have severely hurt the operations of their hospitals, with numerous cancellations of surgeries and other treatments. The doctors argue that the decision was taken by the government without consulting them as they fear it would provoke a sudden influx of poorly trained practitioners. Medical interns are particularly angered. They have unleashed a vast protest movement with about 9,275 or 74.4% interns submitting their resignations to hospitals which were not accepted. Apart from hospitals, the protest movement has spread to medical schools as well. Government officials have said that adding more doctors is necessary to deal with South Korea's rapidly aging population. In a package of policy plans to improve medical services, the government said it will also expand legal protection against malpractice suits and prosecution. It also plans to give incentives for doctors to practice in essential disciplines such as pediatrics and general surgery, and in regional areas where the shortage of doctors is more serious. The country's current doctor-to-patient ratio is among the lowest in the developed world, as per the Organization of Economic Cooperation and Development, or OECD. To cater to the needs of the patients, the government had to open military and police hospitals to civilians and extend the opening hours of public medical institutions. While ordering doctors to return to work, the Yoon Suk-yeol-led government has warned that those who refuse face up to 3 years imprisonment or a 30 million won €20,800 fine, or even revocation of their medical license. While the Justice Minister Park Sung-jae accused them of protecting their personal interests, the demonstrating doctors have accused the government of demonizing them. The shortage of medical personnel is a long-standing problem in South Korea, which has 2.6 doctors per 1,000 people, as per 2022 data, compared with an average of 3.7 and 9.2 for the developed countries in the OECD. With 90% doctors practicing in towns and cities, the government anticipates a shortfall of 15,000 practitioners by 2035, assuming that the rural areas will be the hardest hit.
The demand for medical care has been rapidly increasing, but the needs cannot be met. Especially the number of doctors in essential medical principles has drastically decreased, and it led to the collapse of essential medical services in rural areas. Such a collapse means that the safety and health of people in these areas are now in grave danger.
The government's plan to induct more doctors into the system is popular among the general public, and it has shown a generally unfavorable reaction to the doctor's decision to walk off the job. About 76% of South Koreans support the plan spearheaded by President Yoon Suk-yeol, as per a Gallup Korea poll conducted last week.
There trainee doctors walking off the job is like holding South Korean people hostage. I don't support that. They should find a compromise with the government and discuss hiking the number of medical school entrants.
However, doctors and medical student groups argue that there are already sufficient physicians, and an increase in numbers could lead to unnecessary medical procedures and undermine the finances of the National Health Insurance Plan. The protesters, however, say South Korea has enough doctors, and that the government needs to increase pay and reduce the workload before recruiting more students. If neither party backs down or negotiates, the tug-of-war between the South Korean government and the medical professionals is only likely to intensify in the coming days, leaving those seeking treatment vulnerable.